Good afternoon. Welcome to the KDHE-KHC Infection Prevention Learning Action Network for outpatient settings. If you haven't already, please type into the chat and let us know you have joined us. My name is Michelle Clark, a Senior Director of Quality Initiatives with the Kansas Healthcare Collaborative. I'm pleased to serve as your facilitator today. And Phil Coffin, our Director of Communications, also is assisting with the technical aspects of this event. The session is being recorded and will soon be available for viewing online. And I will share a few brief updates with you so we can quickly get into our featured topic. Phil? Next slide, please. So I can't believe we're already at the halfway point of our Learning Action Network. Today's session will focus on hand hygiene. This is the 5th in our 9-part learning series conducted by the Kansas Department of Health and Environment and its many partners. If you've missed any of the previous sessions, we invite you to visit our webpage at khconline.org/LAN to review the recordings, handouts, and recommended steps to put your learning into action. Next slide. This KDHE-KHC Learning Action Network has an outstanding planning committee who continue to serve as our faculty. We truly appreciate the time and talents being shared by these Kansas healthcare professionals, and this group is a wonderful resource for you. Next slide. We also want to thank everyone who responded to our brief feedback survey. Following each event, we'll provide you with a link where you can let us know what you took away from each session and identify some next steps and how well it met your expectations. And we hope all participants will take a moment to respond at the end of each session. Your insights are helpful to us. We thought you might appreciate a brief summary of this group's feedback from our most recent session 2 weeks ago on the topic of personal protective equipment. And in the interest of time, we encourage you to review this information in your handout at your convenience. I thought there were some great takeaways, and we would just love to see your comments for our hand hygiene session following today's event. Next slide. So without further ado, I'm very pleased to introduce our presenters today. Casey Christini is an infection preventionist with KDHE and is currently a Master of Science candidate in infection control from the University of Essex. She received her bachelor's degree in health science at the University of South Dakota. And after spending time at Seattle Children's Hospital, she has relocated back to the Midwest. Casey is new to the IP role and is excited to bring a fresh outlook on all things ooey and gooey to the KDHE-HAI-AR program. And Esther Knobloch is a quality manager, infection preventionist, and clinical microbiologist at a critical access hospital in Emporia, Kansas. And driven by the desire to ensure quality health care for patients and residents across Kansas, she's pleased to serve as an IP consultant for the KDHE-HAI-AR program. And in addition, Esther volunteers on the American Society of Microbiology's Clinical Microbiology Mentoring Committee, where she develops the next generation of infectious disease microbiologists. And she earned her bachelor's degree in medical laboratory science from Wichita State. And Jill Hardy is an infection preventionist with the University of Kansas Health System and a regional infection preventionist for KDHE. She has been in nursing for 9 years and has found her passion to be in infection prevention. So without further ado, Phil, let's advance to the next slide and we will turn it over to Esther to kick us off. Esther?
Good afternoon and welcome everyone. As we begin our session 5, the topic is hand hygiene, which is arguably the most important cornerstone of infection prevention and control. It's one of the most basic, and yet it has the greatest impact for the safety of patients and residents that are under our care. Today's objectives are to explain hand hygiene and why it is important. We're going to describe and identify common bacteria and the transmission that occurs through hands. We'll demonstrate proper hand hygiene techniques and then discuss auditing, signage, training, and compliance, which are all important components of a good infection prevention and control program. Next slide, please. So We know that hand hygiene is important, and it's been recognized for over 200 years, the impact that clean versus dirty hands have on healthcare outcomes. And yet we still seem to have opportunities with hand hygiene compliance. So it's always good just to start with the why. Why is hand hygiene so critical to providing safe care? And the simplest answer is because our skin contains multitudes of bacteria. From our fingertips to our elbows, there's around 10 million unique organisms that reside on our skin. And you can see the list there. They've done studies to explore what those organisms are. And that list does include human pathogens that are opportunists. And if they have the opportunity to create disease, they will. So it's important for us to make sure that as we're going from patient to patient, that we are making sure our hands are clean and safe. One of the unique statistics that is always impressive to me is that 80% of all microorganisms are spread through touch. So when you think of how simple and cheap hand hygiene is, and yet the impact of reducing 80% of our risk, that is a really good return on our investment. Hand hygiene is simple. Anyone and everyone can be taught how to do it thoroughly and correctly, mindfully, and it's really relatively cheap. When we look at all the other infection control mitigation strategies that we have with HEPA filters and UVC disinfectant, really the cost of soap and water or alcohol-based hand rub is really fairly cheap, and the gain that we get from it is outstanding. Two of the major drivers that really emphasize the need for good hand hygiene are hospital-acquired infections or healthcare-acquired infections and multi-drug resistant organisms. In studying the cause of hospital-acquired infections, nearly 2/3 of them are linked back to the healthcare workers' hands. So again, by doing good hand hygiene, we eliminate 80% of our risk, and we can reduce 2/3 of the hospital-acquired infections. Next slide, please. So here is an example of why it's important for us to do hand hygiene more often than just when we are touching the patient. And in subsequent slides, our colleagues will walk through when those moments are. But I just wanted to share this, this graphic. The green fluorescent spots on the photo show all of the areas within a patient care room that are culture positive within 4 hours of after a patient is admitted to this room. That's really impressive. And again, the focus on those high touch areas, those places where we put our hands all of the time, they do become contaminated. And so it is important that we are cleaning our hands, not only when we are touching the patient, but also whenever we're in the patient environment. It's just good things for us to be aware of, and making sure that we are cleaning our hands, because bacteria can survive on certain surfaces for days. And we definitely want to make sure that none of our healthcare staff take anything home with them or take anything to the next room. So, next slide, please. And I'm going to turn it over to Casey, and she's going to lead us through the polling question.
Casey, I think you're muted.
Can you hear me now?
Yes, we can.
Perfect. Okay. So good afternoon again, everyone. My name is Casey, and I will be doing the first polling question. So we'll give you a few to answer that. Healthcare grade hand washing products contain blank to blank levels of antimicrobial agents.
All right, we'll go ahead and shut down the polling. We'll count to 3.
Perfect.
1, 2, 3. Let's see.
3. Close. So the answer is actually A. It's low to medium products that, or I guess, agents, antimicrobial agents that are access to the healthcare workers. All right, next slide, please. Okay, so oh wait, go back one more. There we go. Okay, so I really hope I do not ruin Disney or this movie for anyone. But let's take a look. So the first image, you can see the matchmaker grabbing onto Mulan's hand. After this, she goes around the table, she grabs a teacup and hands it back to Mulan. And in the second image, you can see the matchmaker has ink on her hand. And then in the third image, you see the matchmaker touching her face and creating the iconic ink mustache. So let's rewatch this, and this time I want you guys to imagine instead of ink, it's a harmful pathogen. And instead of a matchmaker, it's a healthcare worker. And instead of Mulan, it's a patient, a resident, or a family member. These are examples of missed opportunities that are devastating to healthcare. Next slide, please. All right, so what exactly is hand hygiene? It's really just a fancy way of saying you're gonna wash your hands and you're gonna do it in an exact way that makes sense, right? So there are 4 different methods of hand hygiene. The first is plain soap and water, which is just cleaning. The second is antibacterial soap and water, which is a disinfectant. And this is the standard method of hand hygiene. So this should be performed after patient care, after you're coming into contact with bodily fluids such as urine, feces, spit, blood, etc. And also should be performed when your hands are visibly soiled. The next is alcohol-based hand rub, which is a disinfectant, and this is the preferential method of hand hygiene. And in order for it to be the most effective against gram-positive and gram-negative bacteria, it should be between 60 and 95% alcohol. And then surgical sterilization should only be used when necessary, unless you want to sterilize your hands before you make a peanut butter and jelly sandwich. I don't really think that's necessary. All right, next slide. So why do we perform hand hygiene? It really is to reduce pathogens on the hand. And according to WHO, the World Health Organization, hand hygiene or hand pathogens is the main way to spread transmission to our patients and to residents and to other healthcare workers. It's also important to note that bacterial regrowth does occur quickly after you use alcohol-based hand sanitizer, and that's because it does not continuously kill organisms after application, but it's still the preferential method of hand hygiene. It also reduces transmission, so between healthcare workers, patients, the community patients, healthcare workers, whatever order you want to put it in, it helps reduce the transmission rate. Interestingly enough, hand hygiene also has been proven to reduce infections after education. So according to the CDC, diarrheal infections went down 58%, respiratory illnesses such as cold went down 16 to 21%. And also, according to WHO, hand washing with soap could protect about 1 out of every 3 young child from diarrhea infections and almost one of five young children with respiratory infections such as pneumonia. Also, with the decrease in illnesses and sickness, it shows that it reduces the illness, so you have less opportunities to need antibiotics or unnecessary prescribing, which would be an inherent risk for antibiotic resistance. Next slide, please. Thank you. So I won't focus too much on the before and after. Jill will talk about that a little later, but these images show the best method to wash your hands with alcohol-based hand rub, which is in the middle, and then soap and water, which is on the far right. So we'll start with alcohol-based hand rub. So that should be performed for 20 to 30 seconds. You should put a plethora amount of alcohol on your hand. Demonstration here. So this should be about enough. I hold it for like 2 or 3 seconds. You rub your hands, and if you're working in an acute care setting in the hospital, you should not have anything below your elbow, so this would not be on in a clinical setting. But you rub your hands, add friction under the nails, thumbs, wah, 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 and you rub until it's dry. You don't pat it dry. You don't wipe your hands off because then it's not effective. And the same goes for washing your hands with soap and water, but that should be done between 40 to 60 seconds. And instead of turning off the faucet, you should use a paper towel if it's not electric, and then use the paper towel to open the door. Throw it away and your hands are clean. And with that, I will turn it over to Jill. Thank you.
Thank you so much, Casey. That was helpful. Thank you. Next slide, please. All right, how perfect that we're talking about hand hygiene, because on May 5th, it's World Hand Hygiene Day. And so this is an event that the World Health Organization promotes annually. And this year, the slogan, "Second saves lives, clean your hands." So it's a great campaign to build excitement around hand hygiene, because we're constantly talking about it. But this was there's a link in this can download the free downloads, which are posters, Zoom backgrounds, and other resources to show your support. So next slide, please. So let's talk about creating a hand program. If your facility doesn't have a program, this is a great time to start, especially since Hand Hygiene Day is on May 5th. So that would be an excellent kickoff. But let's look at how we can implement a program with feeling overwhelmed or making it overwhelmed. So we're going to just focus on the basics. So step one, we got to commit to having a hand hygiene program, because this isn't something that you just want to do for a couple months and let it fade away. This is going to take your attention, but it's, as you know, it is critically important. So step two, engage stakeholders. Talk to other leaders in your clinic, your facility, and tell them about the importance of hand hygiene in creating a hand hygiene program and what this will look like. When I'm saying hand hygiene program, what it essentially means is that you're going to devise a plan to train your staff on the 5 moments of hand hygiene, so they know the expectation of when they're going to be performing hand hygiene, and then what products to use: alcohol-based hand rub, soap and water, so they have a clear understanding. And then what we will do is train auditors on how to record those monthly observations, and then share the data with staff members, because then we can see, hey, how are we doing with our hand hygiene compliance? Are we doing well? Do we have opportunities for improvement? So this not only keeps patients safe, but it's, like Casey mentioned too, like it's keeping staff safe as well. So it's really, really important. Next slide, please. So think about the potential members of your healthcare team who would be good hand hygiene auditors. So maybe an LPN or a medication aide, a dental hygienist, receptionist. Just who do you think would be a good facility? So after you have identified people to be auditors, you want to train those, and they would train them to observe the moments of hand hygiene. And Casey just went over those moments, and I'm going to show you another slide again for reference, but definitely train to the 5 moments of hand hygiene, and then when to perform hand hygiene appropriately. And then explain to the auditors the why we collect data. So then they understand that this is not just a task that they're tasked with doing, because everybody's day is so busy. And so you never want an auditor to feel like we're just them down with a task. This is really, like I'm saying about patient. So they are like these amazing, detectives ensuring patient safety for all. So we definitely want to commend our auditors for all that they do. And then once you've identified your auditors, make time with them. At least give them like maybe even 30 minutes to validate that they understand the moments of hand hygiene that they're observing. Alcohol-based hand rub versus soap and water. So, give them the example. If someone's hands are visibly soiled, what method of hand hygiene would you be observing for? Would you say that they performed hand hygiene correctly if they just used alcohol-based hand rub, or would it be soap and water? And we know soap and water would be the correct one in that situation. Then you also can think about, decide if your auditors are secret shoppers, unknown to the rest of the staff, or perhaps they would be known to staff as the hand hygiene champion of your clinic. So just decide what works best for you. Next slide, please. So here's a sample auditing form that we have available, and we'll also have this available in case you want to use something similar. We'll have those resources available for you to download. But this is just a simple paper tool to collect audits. But gosh, you could get fancier. You could collect audits in RedCap. There are apps available to computer, so you hand hygiene audits as well. So, but no matter how you do it, you just want to ensure that you have a minimum number of audits collected each month and turned in at the end of each month. And so you want to designate someone to tally up the audits and share the data. So many facilities share hand hygiene data in different ways. Maybe it's via email or during a staff meeting. So I really recommend making your hand hygiene data visible. So if you work in a clinic, perhaps in a break room setting would be a nice place to post your monthly hand hygiene data, or maybe you work in a surgery center where you have a daily huddle and a huddle board. You could post that information there. If you work in skilled nursing, it might be best to post your data on the individual resident hall in a location where staff reside or tend to meet often. So whatever works best for you. But just sharing it and being transparent about it. And, even if your hand hygiene compliance is not where you want it to be at first, just know this is really good that you're auditing because you have room for improvement, and then you can work on improvement efforts. But guess what? You wouldn't have known that unless you had been auditing. So bottom line,
Okay, Jill, I think your screen has frozen. I'm not sure if it's just me. So I'm wondering if we could have one of our other panelists pick up. Let's move to slide 18. I think we just lost Jill. Okay. I believe she'll be dialing back in. Let's see. give her a moment to dial back in. One of the things I might just bring up, and I thought Jill was providing a really good information around establishing some monitoring, surveillance of hand hygiene. One of the things I might suggest is whenever you do begin your program is to maybe not let folks, and I'll let Esther and others weigh in, but maybe collect a baseline, if you will, see what your current hand hygiene compliance is once you kind of get going, and then set a goal. And I can see Jill can talk about this slide when she can return, but you know, set a goal like what will be a target for your organization. And I believe some organizations may target 90%, others may target 95% as a goal. So something to keep in mind so that you can measure your improvement in your hand hygiene program. Okay. Let's go ahead and Esther, I might call on you if we could just go ahead and talk about the resources that Jill has put together for us. Would that be all right?
Yes, I can fill in until Jill comes back. So again, we've been talking about the importance of monitoring. We know that what we measure and what we pay attention to, staff will focus on as well. And so if we're interested in we should be interested in knowing where our compliance rate is at. But when we share that with our staff, when they know that they're being graded, if you will, on their hand hygiene compliance rate, that will help us drive performance. And so again, as Jill has outlined here for us in the slide, by sharing that hand hygiene data, it's very powerful in increasing adherence. It identifies opportunities for improvement. Again, there's no better person to say what opportunities or what barriers there are than that frontline individual who is working in that environment. And then again, it gives you an opportunity to celebrate those successes. So when you see that run chart continue to move upward, that positive trend, you can celebrate as an organization. And so here's an example of just a simple chart that has your month-to-month hand hygiene compliance rate as it was observed by those auditors. Next slide. It's also, again, important to use signage, again, just to raise that awareness. The CDC has a really nice campaign around hand hygiene. There's lots of different promotional items there that you can use both to encourage hand hygiene among staff, but as well as your patients and residents and family members that would be visiting the facility. So if you haven't had an opportunity to look at that CDC reference that she has linked here on the slide, please take a moment to do that, especially in preparation for World Hand Hygiene Day. You'll get lots of really good infographics and ideas for just raising awareness and then therefore increasing compliance with hand hygiene. Next slide. So just like it's important for us to know how to do hand hygiene, when to do it is also very important. And the World Health Organization does recognize 5 moments of when hand hygiene should be completed. This is a really good thing to incorporate into your training for hand hygiene, as well as in your auditing program, making sure that we're paying attention to each of these 5 moments. So obviously, before we touch a patient, we want to make sure that we are approaching them with clean hands and we're not carrying any pathogen into them. It's also important that before we perform a clean or aseptic procedure, we want to start with clean hands. After we have contact with blood or body fluids, we want to make sure that we pause, clean our hands. Even if we've worn gloves, after you doff your gloves, it's important that we perform that hand hygiene after touching the patient. And then the 5th one, again, that we often forget about, but as that first picture showed with all the green spots of where those pathogens live, after we touch a patient's surroundings. So I know sometimes, you know, as staff are maybe passing dietary trays, we put that down on the bedside table and we step out and we don't always recognize that that is an important time that we we complete hand hygiene. Again, as Casey demonstrated for us, there are two methods for hand hygiene, that hand rub and then hand washing. The alcohol-based hand sanitizers are the preferred method for doing hand hygiene, unless our hands would be soiled. And the steps to good, thorough hand hygiene with both of those methods are outlined for you here. Next slide. So as infection preventionists, people do watch us. And so it is important that we are a role model for hand hygiene. One of the things that we haven't really touched on in the slides here, but that is definitely a piece of hand hygiene. Casey alluded to it earlier, wearing jewelry and artificial nails. Again, we want our staff to have hands and fingernails that are clean and safe. So it's important for us as infection preventionists to model that behavior, to make sure that our hands look like what we want staff to model. So just make sure that staff can see in you a good example, because it really demonstrates how much you care. It's really hard to stress the importance of something when your own behavior doesn't align. So you really need to practice what you preach. And not only do the staff pay attention, but the patients are watching as well. Next slide, please. So this brings us to our next polling question. So we can pull that polling question up for you. The World Health Organization's 5 moments of hand hygiene include all of the following except: before and after touching a patient, before a clean or sterile procedure, before the start of your work shift, and after body fluid exposure. So according to the World Health Organization, each of these are one of the 5 moments except for one. Which one is that? I'll give you a couple more seconds. Okay, and if you want to close the poll. All right, great work. Before the start of your work shift is not included in the World Health Organization's 5 moments. I definitely think it is an important time for us to clean our hands, but it's not one of those WHO 5 moments. So thank you everyone for your participation there. And next slide. So here we have a list of the references that were used in building today's slide deck. These are references that we have found valuable around obtaining hand hygiene information. And so I encourage you to take a look at each of these. And next slide, please. And then here's some resources for you. Again, we've got World Hand Hygiene Day coming up. And then there's just some other really good resources that I encourage you to explore. Next slide, please. All right, so our final quiz for today. A patient care assistant noticed that her hands are visibly soiled after caring for a patient. Which method of hand hygiene should she use? Alcohol-based hand sanitizer, soap and water, triclosan containing soap and water, or hand hygiene is not indicated. So when our hands are visibly soiled, what method should we use? All right, couple more seconds. Okay, and let's go ahead and close the poll. Again, great job. You guys were all listening. Again, when our hands are visibly soiled, we want to use soap and water hand hygiene. The antibiotic is not necessary in this situation. Good old-fashioned soap and water with lots of friction is sufficient. And again, if the hands aren't visibly soiled, that alcohol-based hand sanitizer is an excellent option. But in this situation, since they were visibly soiled, we want to use soap and water. So thank you all for your participation. Next slide. Okay, we're going to just review something that's going to be coming up in the homework here. So we've talked a lot about the importance of hand hygiene, the need to audit our hand hygiene compliance rates. And then often when we get those results back, we wonder, how can we drive improvement? And again, the best resource we have in that situation are those on the front lines. And so this barriers or excuses exercise I came across during a hand hygiene collaborative a couple years ago, and I really love this tool. The purpose behind it is you would go out onto the front line, go out to the patients or to the areas where patient care occurs, and find 10 to 20 people and just ask them, why do you think people don't wash their hands when they should? By phrasing the question that way, instead of saying, why don't you wash your hands when you should, that kind of can be a little bit abrasive. And so they might put up their defense. But when you ask it in that non-threatening way, why do you think other people don't wash their hands when they should? You'll get really insightful responses. And so you would just go down, and as you're interviewing those 10 to 20 staff members, just write their reason down. And then I would encourage you to take this document back to your infection control committee and walk through each of those reasons and determine as a group whether or not that is a true barrier or if it's just an excuse. So some examples of barriers, if you want to go to the next slide, please. So some examples of barriers are maybe the soap dispensers are empty. The dispensers are in inconvenient locations, or the paper towels are always empty. Those are things that as an organization you can act on. Those things are things that you can put on a list and work your way through so that you're removing those barriers, and that's not an obstacle to good hand hygiene compliance. On the other side of that, some excuses, people are too busy. Hand hygiene is overrated. I've got gloves on, so I don't need to wash, or my hands are really dry, or it's going to ruin my manicure. So those are some excuses, and those are a little bit more of a challenge to work towards correcting. But again, just explaining the why. And then with the hands being too dry, that could kind of be borderline either place. Maybe that is a barrier, and we need to look at the soap or the hand sanitizer that we are providing for staff, or make facility approved lotions available. So I would encourage you, I think you'll have fun with this. It's always good to just get out of the office, get out from behind the desk, go out onto those patient care units, interview the staff. And I think you'll get some really good insight, and it'll give you a great focus for next steps in your hand hygiene program. Next slide, please. So again, next steps, if you haven't already, make sure that you take 5 to 10 minutes and view that CDC Project Frontline Hand Hygiene course. It's really basic, but full of great information. Definitely something that you can use in your own hand hygiene training programs within your facilities. Complete the barriers or excuses worksheet, and I believe that Michelle has included that in the toolkit. So you'll want to just download, print that off, go out and do your interviews, have fun with it, and then send a copy back to KHC by May 3rd. Additional things to do: review the APIC guideline for hand hygiene programs, review hand hygiene auditing tools, and then if you don't already have one, work towards policy development for consistent measurement and adherence to hand hygiene. All right, and that brings us to the end of our slide deck, and we would welcome your questions at this time.
Great, thank you, Esther. Appreciate that. All right, so I apologize we lost Jill there, but hopefully she'll be able to join us soon. And if anyone has any questions for Esther or Casey, you can type them in the chat or in the Q&A pod. And we put some, if you haven't had a chance to look at the chat yet, we've provided some links there too to the hand hygiene. Thank you, Dr. Warwick, for including the link to the Frontline Hand Hygiene course, as well as the link to the APIC Guide to Hand Hygiene Program for Infection Prevention that Esther mentioned a moment ago. Okay, well, I guess you guys just did a great job, answered all the questions. We're not seeing any questions come in, so we'll go ahead and wrap up.
Michelle?
Yes, ma'am.
Oh, okay, sorry. It looks like there was one question that came through that Robert Geis would like to touch on. I don't know if now is a good time or if we're at the end.
Perfect. Thank you, I missed that. Go ahead, Rob. Rob, are you muted?
Yes, hi, sorry about that. There was a question that came in that asked about a small facility. And they mentioned they usually have about one caregiver on the floor at a time. And they were wondering about how many hand hygiene observations they should try and shoot for in a month. And when I'm out visiting facilities, I like to tell facilities in general, it's a good idea to probably get around 30 hand hygiene observations a month per unit. That's a pretty good number. We use that in statistics to have what we call a normal distribution or a bell curve. In essence, really getting around 30 observations a month is going to give you a pretty good average, pretty good picture of what your truer hand hygiene rate is like. And I like to take tell folks, take varying opportunities to observe all of those 30, hand hygiene opportunities. You might not take them all on the same day at one time, spread them out a little bit, take them for different types of opportunities for which hand hygiene could be done. And you're going to get a better picture of what your staff skills in hand hygiene are.
Thank you, Rob Geist from KDHE, epidemiologist there. Great guidance there. We also have another question. I don't know, Rob, if you'd like to respond to that, maybe Julie or others too, from Maria. In the areas like primary care practice offices, how would you suggest doing hand hygiene audits, as the hand hygiene is often completed once the door is closed?
I'll answer this as well. Yeah, and frequently, sometimes you can implement your other senses to understand whether or not hand hygiene is performed. So I will frequently, even if a door is closed when I'm out doing observations at a facility, I'll just kind of hang out by that door and I'll be listening for the sink to go on. And if the provider's coming out shortly after the sink has come on, or the sound of the hand hygiene alcohol dispenser has gone off, then and that provider is coming out the door at that moment in time, I will often be looking for as well whether or not they're using a paper towel to have turned the doorknob when they exit the room or not, and so or if they're drying their hands as they come out. So that's one way. If anybody else wanted to weigh in and share their experiences.
This is Linda. Can you hear me? Oh, I see Linda's talking. Julie, this is Julie. Linda, hold on one second. Because I couldn't tell who was talking. One thing you can also do is implement it into your patient satisfactions at the end. You can just randomly select a few people a day to fill out just a little card when they leave and ask, did the PCP or did the healthcare worker perform hand hygiene during your visit? You can also get the patient's perspective on hand hygiene, and they can also kind of help you with some of that surveillance.
Thank you, Julie. Linda?
Yeah, I think that's a great idea, Julie, from that perspective also. But one thing that I used to do, don't let those closed doors, be a barrier for you to actually, consider that observation. What I used to do when I worked clinically is I would ask somebody when they come out the door if they performed hand hygiene. And I think the element of surprise frequently results in an honest answer. And, I've had many people say, oh my gosh, no, I didn't do that, thank you. And they go right to, the appropriate station, whether it be an alcohol dispenser or the sink for soap and water, and go ahead, they immediately do perform hand hygiene. So it's also a really good reminder.
Okay, thank you. Thank you. Great suggestions. All right, well, in the interest of time, we have 1 minute left. We'll go ahead and wrap up. Thank you all so much for this great information. We hope you'll plan to join us in 2 weeks for our 6th session on May the 6th, and our topic will be environmental cleaning and disinfection. So I think there'll be a nice segue from hand hygiene to the environment. So join us on May the 6th, and please provide feedback to our session number 5. And then if you are looking for any of the handouts or tools that we've discussed today, please find them on our website at khconline.org/LAN. And we do have a final question we want to ask. So our final session will be June the 17th, and it's kind of a wild card session. So we wanted to get your feedback now that we're halfway through the LAN. What topics would be of interest to you? And I'm going to launch a poll. You can select all that apply and type into the chat if you don't see a topic that, if you can think of another topic that would be good. So we'll take this back to our planning committee and see how we might format our final session. So we'll give you a few seconds here to respond. Thank you all so much. So the options we have on the screen are some, and these are suggestions that have been given in our feedback surveys, like construction, NHSN reporting, putting it all together, what should be in place for an outpatient setting and an infection prevention program, an annual surveillance plan, how to evaluate goals, or just some basic quality one-on-one, how to make improvements. All right, looks like most everyone has responded. I'll go ahead and end the poll. And we'll go ahead and share that. It looks like we've got kind of an annual surveillance plan, how to evaluate goals, and putting it all together, and 101 are the leading ones. So we'll take this back to the committee and then see if there's some other comments that are suggested. And also in your feedback survey, feel free to add suggestions there too. So thank you for that feedback. It's very helpful for us. All right, well, I believe that wraps us up. We'll see you all in 2 weeks. Thank you for joining us today. And I want to give a shout out to those who watch on our recording. We have some folks that are unable to attend this particular time, but have been very diligent in watching the recordings and staying on pace. So thank you all. We'll see you in a couple of weeks.